The investment we've been doing since independence, ideally, are supposed to gravitate the country towards as making the Kenyans to, achieve the highest standards of care that is available, and the healthcare financing strategy, which is also important. There is the Afya Bora Mashinani, principle, which is a UHC model, protecting the people from getting diseases, which is actually more tenable. Now, the other issue that you find that is important is that issue of quality of care. Who is continuously monitoring that our facilities are able to provide the quality of care that we are purchasing? Within the priorities of the sector is to have 4 pillars that are critical in actually achieving UHC. The Afya Bora Mashinani is a primary healthcare model. And the primary healthcare model is designed to do several things. One, improve access to care for the people close to their neighborhood. We make sure that as a country, services are available closer to the people. And this is the aspiration we see within the promise of this government and His Excellency the President.
And in health, we are bound by duty to take measures to make universal health coverage a reality. In our plan, and through your support, we will restructure our primary health system so that we put more resources into promotive, preventive, and early diagnosis.
Sahi hata tukikuwa wagonjwa, CHP inatusaidia. Anapima, alafu anatupatia dawa ya malaria.
Kisumu is one of the areas in which have prevalence of malaria. So they use the RDTs, that is what is locally available for the CHPs to use. They test, then they have to treat.
Kuna wakati nilikuwa na mtoto wangu akiwa 2 years, alikuwa na mgonjwa, najitayarisha kwenda hospitali. Before nitoke, the CHP alikuwa kwa harakati zake za kufanya home visit. Baada ya kuangalia mtoto kupima mtoto malaria, akapatikana iko positive, ako na malaria. Kwa saa hizo alinianzishia mtoto kwa dawa ya AL. Sikupeleka mtoto hospitalini na mtoto aliimprove. Sasa nilifurahia sana kwa sababu up to now kuna magonjwa zenye mtoto akikuwa nayo in the community atuwapeleki kwa hospitali.
The second thing that you should also identify with is the fact that it will be cheaper to do it, not only to the household that did not travel far, but also to the healthcare system, because the disease has not progressed much. Within this model, we have the community healthcare promoters. These are people who are supposed to help household promote and prevent.
Na hakikisha kwamba hii mambo ya afya mashinani imeboreka, na mimi mwenyewe tahakikisha ya kwamba Kajiado imebadilika kwa hivi karibuni, na kuhakikisha kwamba tutakuwa na open defecation free society for a better Kenya, for a better world, and for a better community.
So this kind of toilet, when we move to the community, we talk to the landlords. This kind of toilet is risky to the children. The children, when they come here, they can sink. Even the flies can come here to spread the disease. So we invent a new method called SATO.
Under the water and hygiene sanitation, the CHPs have been trained. Once he or she approaches a household, she can notice if there is latrine in this homestead, if there is hand washing installed in this homestead, and if there isn't, it is now upon the CHP now to take it upon himself or herself to health educate the importance of having such like things.
So the investment surrounding the community healthcare system is designed to make sure that people are preventing and promoting health, including washing your hands. We saw with COVID that after people started washing their hands, other diseases disappeared, because there are basic things that we can do to reduce these communicable diseases, and they have the highest burden in this country.
CHP wangu ametuelimisha ili tutengeneze hii sehemu ya kunawa, mahali pa kunawa. Inafaa niwe na mahali pa kunawa, mtu akitoka choo every time unanawa, na anatuambia sababu ni kwamba tuzuie magonjwa kama ya kuhara. Mtoto pia akizoea, akienda kushika chakula atajua ni ameshanawa.
The CHPs have been very, very instrumental in delivering our 2-step model. We are able to scale up HPV testing and treatment in the community, and by that we are going to save so many women's life, because you're going to detect the virus early and prevent them from getting cervical cancer.
We were sampling women from 30 to 49 years old. We were trained on how to take the samples so that we train the clients to do the testing themselves.
So that is why this primary healthcare agenda is important, not only for community, but also for the primary. So you look at the community health promoter identifying the problem in the household. So from the community, the household is not on its own. It is with its own community health promoter. Then they refer to level 2 and 3. Those are primary healthcare facilities. They have a gadget which is provided to link them to the next level of care, so that it's easy to do some follow-up.
The second phase was looking at how to improve service delivery using digital solutions. That is the phase when you are talking about electronic medical records, mainly focus on case management for the patient. And then the last area where we are at the moment is about interoperability. And interoperability simply means how do we make sure that whatever systems you have, based on agreed standards, you are able to talk to each other.
Na tunashukuru kwa kutusaidia tusibebe ile kitabu msito, tubebe ile simu ambayo inaweza nakili mambo mazuri na inaweza ikachukua taarifa kwa urahisi.
So this is the first time the government has, enrolled, the community health volunteer who have been turned into promoters, of course with rigorous training on what they should be able to cover as a own package, how they are supposed to use their gadgets, what can they do and what they cannot do. All that is outlined very clearly within our MOH guidelines, and is also the MOH strategy on community health. So it's nothing like guessing. And this is the first time the government is taking lead in financing them. That means this government is appreciating the use of community health promoter, and more importantly, its desire to center the UHC agenda within a health promotion and preventive system.
Kisumu County as a government has done wonders to the community health promoters. They've been on stipend, that is a monthly stipend, and at times it takes like quarterly. They get it after 3 months, but it is up to date.
Now within the financing system, we'll find that the primary healthcare level, which are level 2 and 3 facilities, are at the county level. Counties on their own, they had done registrations to make sure that the money that is generated in a facility is used there, public facilities, to actually generate, more good services for the people, so that more people go there.
The Facility Improvement Fund is made up of all revenue collected from service offered in the hospitals, the staff in the hospital, and many other areas, including putting up facilities in Nakuru County.
Now that enables them to quickly fix, the challenges that they would have at facility level. So that the same way a private facility is retaining money to improve service, then a public facility should also retain money to improve service. The same way an FBO will retain the money and improve the service, so that the public facilities are not disadvantaged in terms of provision of care. And therefore, health get funding, public facilities improve in terms of services because they have money. You saw the president flagging off the community health promoters kits to go to all the 47 counties, which was a fantastic thing in line with the promise, so that they start working. Now, by the time they are starting to work, the next thing is they are referring people to primary healthcare facilities. If you look at one of the pillars within the UHC, which is being prioritized for achieving this health agenda, is actually human resource. Now, I want to first highlight that the healthcare sector is labor intensive, because you need the healthcare workers to provide services. Of course, UHC is the ultimate. All of us want to go there. We want all Kenyans to access services of quality when they need it without incurring catastrophic health expedition.